Good morning, students. Today, I am going to teach you a new topic in the central nervous system infection. That is infective syndromes of central nervous system infection. So, in these topics, we are going to study about various infective syndromes or infections which are attacking the central nervous system. You all know that central nervous system consists of brain and spinal cord. So at the end of the chapter, we are going to learn about various objectives like what are the different examples of infective syndromes and how they are transmitted and mainly the route of infection, and coming to the types and agents of meningitis. What is the difference between meningitis and encephalitis, encephalopathy, and space occupying lesions of the central nervous system, and CSF shunt infections. So in this chapter, we are familiarizing with the different terminologies, that is the infections of the central nervous system. So in detail, one by one, we will study in the other chapter. So in this chapter, we are totally giving an overall idea what are all the different infections which is attacking the central nervous system. So coming to the introduction of the topic, first we should know the central nervous system infections account for significant morbidity and mortality. And you should know the different parts of the central nervous system, which mainly consist of brain and spinal cord. These organs are mainly covered by the meninges. This meninges is having three layers, that is the outermost dura mater, middle arachnoid mater, and the inner pia mater. Arachnoid mater and pia mater together called as leptomeninges. So that is the different parts of the central nervous system. So between and around the meninges, there are spaces which is also called as epidural, subdural, and subarachnoid space. So next I'm going to show you the anatomy of the central nervous system. In this particular diagram, you can see these three things, like is dura mater, arachnoid mater, and pia mater. This is the meningeal layers. You can see the blood vessel here, and above this dura mater, you can see the epidural space. You can see here the brain tissues, and in the brain tissue we have got neurons as well as blood vessel, and this particular area where the blood vessel is passing, that is called as perivascular space. So this is a brief introduction, this one anatomy of the central nervous system. And then next, we are going to study about various infective syndromes. So infective syndromes include infections of these various parts, what I already discussed, like the inflammation of the meninges, inflammation of the brain tissue, that may be either encephalitis or encephalopathy, or we can have the space occupying lesions by some of the condition like brain access, and even we have to study about the shunt infection. So usually by keeping the shunt from brain to other organs, it can also get infected. So first and foremost thing is meningitis. We will study in detail again, but for the time being, meningitis is the inflammation of the meninges. Based upon the organisms and the time duration of the infection, it is again classified into acute bacterial meningitis, which can be produced by most of the bacteria like pneumococcus or streptococcus pneumoniae, meningococcus or Neisseria meningitis, Haemophilus influenza, Listeria, Streptococcus agalactiae, gram-negative bacilli like Escherichia coli. So this acute bacterial meningitis is also age dependent. That means in different age group, the positive organism may also differ. There are viral agents also which can produce the acute viral meningitis, which include enterovirus, herpes virus, and some of the other viruses are also involved. Next, coming to the chronic meningitis, which has got a longer time duration of infection. It is also produced by bacteria, viral and parasitic agents. Even fungus also can cause chronic meningitis. The major bacteria include Mycobacterium tuberculosis and the fungus include Cryptococcus. Next definition or terminology what you have to know is encephalitis and encephalopathy. Encephalitis is the inflammation of the brain parenchyma, where most of the time it is produced by the viruses. So, where herpes virus, rabies virus, arboviruses, which are arthropod-borne viruses like Japanese bee encephalitis, sometimes the parasite like Toxoplasma can produce encephalitis. But when coming to the encephalopathy is not an infection. There is no inflammation as such, but it is mainly produced by slow viruses infections like Kuru or Creutzfeldt-Jakob disease. Even malaria of the central nervous system, that is cerebral malaria, can also produce encephalopathy. Next one, coming to the space occupying lesions, where you can see focal central nervous system infections, lesions like brain abscess produced by various bacteria, subdural empyema, and epidural abscess. These are the focal central nervous system lesions. Space occupied. Cystic parasitic diseases like as neurocysticercosis produced by Tinea solium. Cystic echinococcosis produced by Echinococcus granulosus are come under the cystic parasitic diseases. Sometimes the central nervous system also may be infected by other infective syndromes that include suppurative intracranial thrombophlebitis, CSF shunt infections, myelitis. It is mainly the inflammation of the myelin sheath. In case of poliomyelitis, we can see this one. Neurotoxin mediated complications, which is mainly by Clostridium tetanus or Clostridium botulinum, either in case of tetanus or in botulism, you can see this condition. So, in detail, we will study one by one. Before that one, we should know how these infections are transmitted either into brain or into the spinal cord or into the meninges. It is mainly because of two routes. One is hematogenous route, that means from the blood. So this is the most common route. What is happening here? The bacteria or the viral or the other parasitic or fungal agents entering into the subarachnoid space through choroid plexus or through other blood vessels of the brain. Sometimes the infective agents can enter directly into the meninges, which is because of the infections which are present near to the central nervous system, which include otitis media, mastoiditis, sinusitis, where there will be direct spread of this bacteria or the other agents into the brain. Still, we have to study the root of infections where anatomical defect in the central nervous system because of surgery or because of any trauma occurring after accidents, sometimes in children with congenital defects, which can lead to the organisms entering into the central nervous system infections. Direct intraneural spread is also possible in some of the viral infections where rabies virus, herpes simplex virus can get infected, can produce infection through the direct intraneural spread. So next we will study one by one the different infective syndromes and the causative agents, how to manage it, what are the different lab diagnosis protocols we have to follow for diagnosing these infections. First, coming to meninges, I already told that meningitis is an inflammation of the meninges, that is the inner two layer of the meninges, either arachnoid and pia matter involved, surrounding the brain and spinal cord with involvement of the subarachnoid space. So meningitis is mainly the inflammation of the meninges. Type of meningitis, there are two types of meningitis mainly. One is acute meningitis. The second one is chronic meningitis. So in acute meningitis, we have got acute fulminant illness rapidly in few hours. So once the bacteria enter into the meninges, the infection will start immediately within hours. So acute meaning itself is fast or with a sudden onset. It is further grouped into acute bacterial and acute viral. So based upon the causative agents, it is again as bacterial or viral. Bacteria is also called as pyogenic meningitis because there is a significant amount of pus production or significant amount of presence of neutrophils in that particular infected area. That is also called as pyogenic meningitis. Next category is the chronic meningitis, which takes a long duration for the infections, progressively worsens over 4 weeks. Over weeks, or it is the infection may occur around 4 weeks or more than 4 weeks. That is again produced by different agents like bacterial, parasitic, fungal, as well as viral agents. Some of the agents from this can produce a subacute course that sometimes may worsen in several days, even though it comes under the chronic meningitis category. We should know about the different agents of these particular infections. First one is bacterial agents. So common bacterial agents include partially treated suppurative meningitis, parameningeal infections such as otitis media, infection with Mycobacterium tuberculosis, infection with Borrelia burgdorferi in case of Lyme disease, Trichomo pallidum which causes syphilis, either in secondary syphilis or tertiary syphilis. You can get the chronic meningitis. Rare bacterial agents include Nocardia, Actinomycetes, Tropinema whipple, and Leptospira. Even Brucella also can rarely produce this chronic meningitis. Most of the viral agents include mumps virus, echovirus, herpes virus, HIV, and lymphocytic choriomeningitis virus are responsible for the viral agents in chronic meningitis. Parasitic agents include Toxoplasma gondii, free-living amoeba like Naegleria fowleri or Balamuthia, Trypanosoma brucei. In some part of the pathogenesis conditions, you can see the African sleeping sickness, the involvement of the brain meninges. Angiostrongylosis catunensis, Gnathostomas spinigarum, Bailey Saccharis, Rosayonis, cysticercosis, schistosomiasis, echinococcal diseases, Toxocara canis and Trichinella. These are the different parasitic agents. Coming to the fungal agents, we have got Cryptococcus neoformans, Canada albicans, Blastomyces dermatitis, Histoplasma capsulatum, Coccidioides simitis, Aspergillus species, Sporothrix schenki, Pseudolisteria boydii, and Cladophyllophora bantiana. What is the chronic meningitis? Chronic meningitis is a meningitis which is occurring a disease progression of more than 4 weeks, associated with persistent inflammatory response in the central nervous system infections. Whenever there is an inflammation of the meninges, the inflammatory changes you can observe in the surrounding CSF, that is cerebrospinal fluid. So where the white blood cell count is more than 5 per microliter. Even infections are mainly producing the chronic meningitis, but sometimes malignancy, autoimmune disease, chemical meningitis also possible, where they are the agents of chronic meningitis. Clinical forms of chronic meningitis is again classified into chronic persistent and chronic recurrent meningitis, where in chronic meningitis you can see the CSF is contains mainly the lymphocytic conditions. Neutrophils will be elevated, but predominantly you can see the lymphocytes because it is a chronic condition. There is another terminology which comes in the chronic meningitis, that is aseptic meningitis. Infectious etiology is unidentified, aseptic meaning lack of infection. Most of the time viral meningitis, where there won't be any changes in the inflammatory cells, or the CSF findings will be looking normal, but there will be CSF findings will be normal as far as the infectious inflammatory cells are concerned. That is why it is called as aseptic. What are the different clinical manifestations you are going to observe in the chronic in the meningitis in general? Patient may be having high-grade fever. Sometimes they may vomiting will be there, headache, neck rigidity, Kernick sign and Brudzinski sign may be present in the case of this particular meningeal or brain involved. Next category is the encephalitis. As I already discussed, I am giving the classification one by one. Next is encephalitis. Encephalitis is mainly the inflammation of the brain parenchyma by invasion of infectious agents. So in the encephalitis, more than the bacteria, viral agents are more important. Here, what are the changes you can see, or what are the clinical manifestations? Altered consciousness or altered sensorium. Person may show behavioral changes. Sometimes it is associated with seizures. Focal neurological deficits, sometimes you can see. Extrapyramidal signs like involuntary movements of the different organs also can be seen in case of encephalitis. Here, mainly it is produced by viruses followed by the parasites. Viruses include rabies virus, herpes virus, and arboviruses. Example include Japanese encephalitis and West Nile viruses. Parasites which are producing infections include Toxoplasma gondii and Naegleria fowleri, which is a free-living amoeba. So here encephalitis, since it is the involvement of virus and parasites are there, you cannot observe neutrophils much. Here lymphocytic findings will be more in the CSF than the neutrophils. So usually whenever there is an encephalitis, it is concomitant with the meningitis. So encephalitis seeing encephalitis alone is very rare. So usually you can see involvement of both the organs, that is the meningeal layer as well as the brain. So it is meningoencephalitis is another terminology where both encephalitis and meningitis is there. So example, primary amoebic meningoencephalitis, it is mainly produced by Naegleria fowleri. Next, the next terminology is encephalopathy. Encephalopathy means it's a pathological condition, diffuse disease of the brain that alters brain function or structure. Etiology include mainly the slow viral infections, prions or cerebral malaria. Non-infectious agents became other include metabolic encephalopathy, hepatic encephalopathy, uremic encephalopathy, and brain tumor, etc. Here, altered mental status, and the person may be showing loss of memory, personality changes, inability to concentrate, lethargy, progressive loss of consciousness is also seen in the encephalopathy conditions. So what we are going to do in the laboratory diagnosis? In laboratory diagnosis, mainly we will do the CSF examination. In case of bacterial, viral, parasitic, and fungal examination, there will be changes accordingly. Imaging studies like CT scan, MRI scan, electroencephalograms to study the electrical conductive activity of the brain can also be studied. In case of the last one is space occupying lesions, where we can see focal central nervous system lesions can be seen. Sometimes parasitic cystic lesions also can be seen. Focal central nervous system lesions include collection of pus, the brain abscess, and the parasitic lesions. We can see the Echinococcus granulosus sometimes produce hydrated cyst that it can be seen in cystic parasitic disease. Brain abscess, subdural empyema, epidural abscess are the different focal CNS lesion produced by bacteria. Brain abscess, where uncommon but serious life-threatening condition characterized by formation of localized collection of pus within a cavity of brain, which is formed by breakdown of tissues. So next one is source of infection, contagious infections, hematogenous spread through direct inoculation and cryptogenic. Location mainly the frontal temporal, followed by frontal parietal, parietal. In the etiology of brain abscess, it is mainly produced by anaerobes. Even other aerobic streptococci also can be seen. Fusobacterium, Staphylococcus aureus, enterobacterial members also responsible for the brain abscess. In immunocompromised hosts, where person suffering with HIV, or those who are undergone organ transplantation, or person with malignancy or immunosuppressive therapy, you can see the formation of brain abscess. Most brain abscesses are produced by nocardia, Toxoplasma gondii, Aspergillus, Candida, and Cryptococcus. Tinea solium or Mycobacterium tuberculosis also can produce brain abscess-like conditions. So here also the clinical features include severe headache and focal neurological deficit you can see. Other features may include mental status changes, seizures, nausea, vomiting, nuclear rigidity, and papillary edema. So next one coming to the brain abscess. So here the diagnosis we can do MRI and CT scan. You can see here the diagram of the space of brain abscess in the brain parenchymal tissue, and you can diagnose either by the abscess aspirate. You can do the culture of that one, either aerobic or anaerobic. Even for fungal and mycobacterial etiology, we will do that particular diagnostic cultures. Gram staining, acid fast staining, and special fungal staining can be used. Histopathological examination of the brain tissue reveals the pathological conditions. Anti-cystocercal antibodies in case of neurocytosis. Neurocystosis can be done. PCR detecting 16S ribosomal genes, even blood culture also possible. So in coming to the treatment of brain abscess, we can do surgical excision mainly and a drainage, ceftriaxone plus metronidazole, which is given to treat both anaerobic as well as other bacterial etiologies suspected. Next stage of pain is subdural empyema, where intracranial focal collection of purulent material. 90% of the cases it is in the frontal lobe. You can see the diagram here. Epidural abscess formation. Subdural empyema, and you can see the epidural abscess, that is intracranial and spinal epidural abscess. You can see suppurative intracranial thrombophlebitis is another condition which is mainly associated with the septic phlebitis of the lateral sinuses, mastitis and otitis media. So treatment of the suppurative intracranial thrombosis include treatment with antibiotics, hydration, and removal of infected tissue, and thrombus in septic lateral or cavernous sinus thrombosis. And the last one is the CSF shunt infection. Ventricular shunt is kept when neurosurgical procedures are followed. The channel is created to divert the excess CSF production into body cavities like ventriculoperitoneal shunt, where it can be reabsorbed. Useful in hydrocephalus, where CSF is increasingly produced in the meningeal cavities. Abnormally excess CSF will be produced where shunt is kept into the peritoneum. So, where the normal flora like Coagulus negative Staphylococcus, Staphylococcus aureus, and Propionibacterium can produce this particular CSF shunt infection. Gram-negative organisms like Acinetobacter, Pseudomonas, Klebsiella, Escherichia coli, Serratia, and even fungus, Candida species also can produce this CSF shunt infection. You can see in the cultures, mainly the shunt tip, shunt valve, and cerebrosinus fluid may show this infective agents after culture. The last one is the myelitis, where myelitis is the inflammation of the myelin, inflammation of the spinal cord, where myelin sheath is inflamed and results in disruption of the connection. It is mainly produced by poliovirus, which causes poliomyelitis. Non-viral agents also include Mycoplasma pneumoniae, tuberculosis, syphilis, and tuberculosis, Cryptococcus Candida, histoplasmosis, and blastomycosis in the fungal agents. Schistosoma, Toxocara, Echinococcus, Tinea solium, Trichinella, and Plasmodium may be in the parasitic case portion. And last one is the neurotoxin mediated infections, that is tetanus and botulism, which both are produced by the toxins of the Clostridium species, either the Clostridium tetani or the Clostridium botulinum. So this is what I just gave an introduction of the different infective syndromes of the central nervous system. So we have got meningitis, encephalitis, encephalopathy, space occupying lesions, and the neurotoxin mediated infections. These are the different headings where we studied about the different type of infections. So about each and every infections we will study in the respective chapter when we are studying about the in detail. So thank you all of you for patient listening of this topic.